You've been diagnosed with breast cancer. Now what? Breast cancer can be diagnosed in a number of different ways, most commonly by routine mammogram screening, where an abnormality is seen on the mammogram. Breast cancer can also be diagnosed on self-breast exam, meaning that a person notices a lump or a change in the breast, which leads to a doctor's evaluation and a biopsy resulting in a breast cancer diagnosis. Breast cancer may also present as a change in the breast. So that could be a change in skin texture or skin color. That could be breast swelling or nipple discharge, which can be clear or can be bloody. Sometimes a person may develop breast pain as well. After a diagnosis of breast cancer is made by a biopsy and pathologic confirmation, then many things start to happen. The treatment of breast cancer requires often surgery, sometimes chemotherapy, sometimes radiation, and sometimes anti-estrogen treatment. The fifth step is to sometimes take newer targeted therapies, such as Herceptin, for up to 1 year. So a person may end up seeing many different physicians, including a surgeon, medical oncologist, and radiation oncologist. Now, the reason to check the lymph glands in breast cancer is to determine if the cancer has spread from the breast to the lymph glands. So we check the lymph gland under the arm for cancer because if we see cancer in the lymph gland, that means there could be microscopic cancer cells floating out in the body somewhere else that we need to treat with chemotherapy, because if we don't, then it could potentially grow back later. Radiation is also often used in breast cancer treatment. Radiation is used after a lumpectomy. So radiation is given to the breast tissue after lumpectomy surgery to prevent the cancer from coming back in the breast. Sometimes radiation is used after a mastectomy, which is complete removal of the breast, if there is a risk of that cancer coming back to the chest wall. Life can be good after breast cancer. Treatment side effects go away, energy gets better, hair will grow back after chemotherapy. It's often curly to start with, but then it gets back to the normal hair before treatment. Reconstructive surgery does really well to do breast reconstruction. There is hope for cure in breast cancer and hope for a long, successful, happy life.